Hey, mental health advocates. So have you ever cared for a patient who complains of chest tightness, racing thoughts, or restlessness, but, all the cardiac workups come back clean? You might actually be looking at anxiety disorders, the most common mental health conditions worldwide, and honestly, often misunderstood. Let's break down what anxiety looks like clinically, how to treat it, and how nurses can help patients reclaim calm in the chaos. Anxiety disorders involve excessive fear or worry that's persistent and impairs daily life. They're more than just nervousness. They cause real physical and emotional distress. Some common types include generalized anxiety disorder, which is chronic worry about multiple life areas; panic disorder, which means recurrent panic attacks with fear of recurrence; social anxiety disorder, that's an intense fear of judgment in social situations; specific phobias, which are irrational fears of specific objects or situations; and also separation anxiety and selective mutism, which we often see in children. So what causes anxiety? Well, it can run in families, so genetics play a role. There's also neurochemistry like imbalances in serotonin, norepinephrine, and GABA. Brain structures matter too, with a hyperactive amygdala and a dysfunctional prefrontal cortex being involved. Life stressors such as trauma, loss, or chronic illness can contribute. And don't forget, substance use or withdrawal can also be a factor. Alright, let's talk about treatment options for anxiety. When it comes to pharmacologic therapy, SSRIs like sertraline and escitalopram are considered first line. SNRIs such as venlafaxine and duloxetine are also commonly used. Benzodiazepines like lorazepam or alprazolam can be effective, but they're really meant for short-term use only, due to the risk of dependence. There's also buspirone, which is a non-sedating anxiolytic specifically for generalized anxiety disorder. Beta blockers are another option, especially for performance anxiety. Now, moving on to psychotherapy, cognitive behavioral therapy, or CBT, is the gold standard. Exposure therapy is especially helpful for phobias and panic disorders. And don't forget about relaxation training and mindfulness. These can make a big difference too. So, what are the nursing priorities when caring for someone with anxiety? First, it's important to recognize and assess symptoms. You'll want to use tools like the JD7 and always ask about physical symptoms, things like palpitations, chest pain, or gastrointestinal upset. It's also key to rule out any medical mimics, such as hyperthyroidism or cardiac arrhythmias. Next, focus on establishing trust and reducing stimuli. Speak calmly, offer reassurance without minimizing their feelings, and make sure the environment is quiet and non-threatening, especially during acute anxiety episodes. Teaching coping strategies is another priority. Deep breathing, progressive muscle relaxation, journaling, and guided imagery can all help. Encourage patients to keep regular sleep and exercise routines too. When it comes to medication education, discuss that SSRIs and SNRIs can take a while to work, warn about the risks of benzodiazepines, and emphasize the importance of consistency with therapy. Finally, promote support systems by involving family when it's appropriate, and refer patients to support groups or therapy resources as needed. Here's the bottom line. Calm really does start with care. Anxiety may feel overwhelming, but with the right education, empathy, and interventions, nurses can truly be the anchor patients need to regain their sense of control. So, what's your favorite anxiety-reducing technique to teach patients? I'd love to hear about it. Drop it in the comments. And don't forget to like, subscribe, and follow for more mental health care tools, because every calm moment begins with compassionate care. And remember, observe, reassure, empower peace.